Good afternoon, everybody. My name is Armando Gonzalez, and I'm a registered nurse leader. Being a registered nurse leader means I'm a registered nurse, and I have the honor and privilege to lead nurses and other healthcare providers into providing the best, safest, most competent care for all patients who need help, whether they're receiving care in the home, in the hospital, the clinic, or even a nursing home. COVID-19 is relentless. It's making thousands of people sick, and it's also taking people's lives. This is not something that we can afford to be lax about. It's not something that we can say, you know what, it's going to get over, it's going to be done, because it's not. It's going to take a lot of work. I want to share with you some of the burden, some of the pain, some of the anxiety that I have regarding COVID-19 and the patients that my staff serves. I'm also anxious for my staff as well. This past week, I found out that one of my nurses is positive for COVID-19. She's got pneumonia, she's in the hospital, and she's not doing well. Right now, she's not doing well, but we're praying and hoping that she gets better and that she comes back, not just comes back to work, but that she'll be able to go home and be healthy and feel better soon. We care about you, we love you, and you're in our prayers. She's an outstanding nurse, and she is very dedicated to all of her patients. She's always wanted to do work, and she never once has had any fear of COVID-19 whatsoever. In fact, she's always told me, Mondo, I'm not worried about it. Just give me the PPE, and I'll see everybody that I have to see. She's an outstanding nurse, but now she's turned into a patient, and she's paying a very, very hefty price for the ability to go out and take care of patients, because that's what she does. She took a vow as a nurse, and she has a moral obligation to do so. And for that, I am grateful. And you should be grateful too. I want to make a statement on behalf of all healthcare providers and on all and for all healthcare leaders as well. Please, as Americans, we've got to do the best we possibly can to make sure that people are safe. When you see pictures on the news or online or wherever, and nurses have got stains on their faces and bruises on their faces, cuts from wearing masks for hours and hours and hours, they're crying because they've had to let people go, and they've had people die because they've seen people who are dying alone in hospitals and healthcare settings because they can't help. It's becoming very, very stressful. And there is going to be a time when we're going to start seeing post-traumatic stress disorder from these healthcare providers. And it's not just nurses. It's physical therapists, occupational therapists, people who are working in environmental services, dietary services. Everybody who's working in healthcare and all first responders are doing the absolute best they can to make sure that everybody is safe. So please believe when you see the pictures. Please trust that nurses are getting sick, healthcare providers as a general are getting sick because they're being responsible and taking care of you, American people, and society. On behalf of my staff and my colleagues, please, please, please stay home. Believe what you're seeing. Believe what you're hearing. Right now, the government is having conflicting things that they're saying about we should be doing this, but we're doing this. The government is opening up things in a time that is way too soon. And I think that most healthcare providers and most people who are specialized in infectious disease will probably say the same thing. It's way too early. It's way too early. So please take care of yourself. Please take care of the people around you. Make sure that you're staying healthy so that you don't have to come into a healthcare setting where one of my nurses will be taking care of you. Stay home. Wash your hands. Socially distance. Make sure that when you are going out that you're wearing a mask. Please remember the people that I lead, I myself, care about you, care about all the people that we serve, and we really, really, really want to make sure we come through this on the other side. For all healthcare workers out there, please understand and please know that your leadership is worried about you, and we are trying our absolute best to make sure that you're staying healthy. Personally, I stay up late at night. I think about my nurses who are sick. I worry about the next shift. I worry about the next couple of days. Are my people going to be able to stay safe so that they can take care of you? My colleagues also feel the same way. We care for you as individuals, but we also care for you as professionals, and we also care for you as people who have taken an oath to care for other people. Please don't grow weary in well-doing. It is a lot of work, and it's very stressful, but please remember that you will be receiving rewards from this, from being a good person, a good healthcare provider, but also making sure that we as a society stay healthy and get better. Please, everybody watching this video, take care of yourself, take care of your neighbors, take care of other people who are healthcare providers and first responders. Please do the next right thing, and please remember America and the world in your prayers. We are committed, we are willing, and we are able. Thank you.